Hey everybody, welcome back to another episode of the I Believe podcast. I'm here with Allie, who is a patient, and she's actually in Arizona like me, so we're all just slowly melting here. But she is someone who's had the Hepzato Kit treatment, I think now 3 times, and she has a tumor that was really pretty large the first time that she ever talked to me on Instagram, like over a year ago. And this tumor has now shrunk from it's about half its size, like its largest size right now, right? According to your latest, like at least whatever latest information that you've had to work with, which is insane to kind of think about, especially for any of you guys dealing with a larger tumor on your liver, which I know, like Allie, like you've had so much discomfort from this, like it's just been a huge, a huge buzzkill, so to speak. Like if
Yes.
cancer wasn't enough, we say, like we joke, but like you guys know what we're talking about. But Allie, thanks so much for joining us.
Of
And
course.
thank you for taking the time. I know this last few weeks have just been a little up and down, but I'm really glad that this treatment has been something that's been able to prolong your life and prolong your quality of life. And I just think that it's really pretty incredible. So coming to talk to you, like as a patient who's actually prepping for Hepzato myself, I wanted to just have a chat with you about this and just
Yes.
get a little like into the nitty gritty of your story and your experience so far in Arizona
Okay.
with the Honor Health facility here. So,
Sounds good.
Allie, do you want to just give us the elevator version of your OM to your metastatic journey?
Yes, absolutely. So I was first diagnosed in 2016. The interesting thing about me is I was actually 24 weeks pregnant with my second son during this time. So as you can imagine, you're pregnant, you have hormones, you have craziness already.
Yeah.
And then to add a cancer diagnosis on top of that was just crazy to me. Just because, melanoma does not run in my family. I have a lovely mutated gene. So I never even thought cancer would ever pop up in my life. So I was actually seen at Rochester, Minnesota with Dr. Polito. He was one of the best ocular melanoma doctors. I was actually one of his last patients before he retired, that I got to go and see him, and he was the best. So I got to have the brachial plaque therapy done safely with my son. I was able to stay in the hospital in the labor and delivery room at their hospital. So baby was monitored all the time. I had an OBGYN come in all the time, and as well as my eye doctor come in also. Everything went as smooth as you possibly would ask for. But the cool thing about me for that journey is I actually got my journey recorded. I was actually in the Mayo Clinic documentary
Oh, very cool.
for the Mayo Clinic. It was actually recorded by Tom Hanks. I thought that was the coolest thing ever. So I'm in that documentary also. And
Well, that's
but
super
yeah,
cool. You're gonna
I
have to tell us
know.
the name of that, and I'll like link that up in the show notes if you
Yeah,
can.
it's really cool for anybody who's just starting out. It literally talks about my whole entire journey. It shows the plaque, it shows everything. So it's kind of nice and kind of a little education also. I had my plaque therapy done. I went back after Oben was born and found out everything was shrinking, everything was dying, and it went great. I ended up being in remission after the 5 years. And then for my 8-year checkup, I came back in and was having a little bit of pain in that liver side and ended up getting some scans and found out that it's came back again and it was pretty big. And I have two big clusters or two big tumors with a lot of little pepper sprinkles, lots of them. So that was my journey. Now I'm
Yeah,
here
no,
in Arizona.
I remembered like connecting with you. I think it was on Instagram like last spring maybe, and you were
Yeah.
telling me, some of the journey to even getting diagnosed with metastatic disease
Hmm.
because you guys had to deal with some of the ins and outs of just not being able to get your scans as often as you needed to
Yes.
have had them, like
Yeah.
even with being past that 5 year mark,
Yep.
and it frustrates me. Like obviously we can't go back and change it, right? Like it's just
No.
what it is for the moment, but it frustrates me when I hear that for patients because it's like no, we
Yes.
we don't just stop being at risk at 5 years. Like you have to keep
Exactly.
watching us. There's a reason our doctors are advocating for watching.
Exactly.
And it's obviously never ideal to deal with metastases. But like the way that I have seen you navigate this with you and your young family, like, I mean, it's been really, just really powerful to me. I think just
Hmm.
seeing how you have navigated this as an individual, and just the, you know, the level of hope that you have instilled in patients, you know, by sharing your own story
Yeah.
online, but also just in your immediate circle, like with your family and your little kids, and just helping them kind
Hmm.
of process all of this. And I'm like actually kind of like low key, like as excited as I can be, right, for our kids to like mutually have this connection, but
Yes.
also like the like potential for just being able to do some stuff over the summer is, you
Hmm.
know, that's helpful. Just to know that that's an opportunity. I know that most patients, like, we don't typically run into someone our age with kids our age, like who we can
No,
just
we
hang out
don't.
with and like relate to, and that our kids can relate to, right? So I know, like, historically you've had kind of a few things going on to try
Hmm.
to control what was going on in your liver when it was discovered last year, and that was
Hmm.
in 2024, correct? Like early
Yes. Yes.
2024. Okay, and so
Yep.
then you guys ended up moving to Arizona to be under the
Yep.
care of Dr. Justin Moser, who's here in the
Yes.
Honor Health Scottsdale, the Honor Health Research Institute. You guys, you
Yep.
guys probably know him. He's been on the I Believe podcast a bazillion times, but he's also helped to host our most recent I Believe seminar, which took place in October of 2024. So just
Hmm.
this last year in Arizona. Those are on the YouTube channel. You can go back and find some of the recordings from there if you haven't like gotten a chance to. But he's kind of famous.
He is.
We're making
He's
him
the
famous,
coolest.
like in addition to all these other wonderful doctors that we have. But I know that you moved here to be closer to care and to family.
Yes.
But what changed, like in your kind of treatment landscape? Like, I don't want to go into everything that you had done before,
Hmm.
just because that's really not
Yeah.
super relevant for the moment. But what changed that Hepzato became something on the table?
Yeah, so I started off with Chemtrack, and Chemtrack just didn't work for me. It's, every patient is different, and it just was not doing what it needed to do to my tumors. And with me having a bunch of tumors, I wasn't a candidate to get them ablated because they were so big. So Hepzato was something that we kind of felt was kind of the best path, and I'm totally thankful that it was out there for me because
Yeah.
it's a great treatment. It really is.
So I think if I'm remembering correctly, part of the reason, like, for trying Kimtrack first and just kind of seeing if there was anything else along the
Hmm.
way was because you guys didn't even get here to Arizona until like roughly May, I think.
Yeah,
If
we
I'm
got here in yeah, we got here in June.
okay, June.
And
So you
so
had
we
to
wanted.
wait.
Yeah, we wanted to wait and just do Chemtrack because we were trying to hold my liver for another treatment. It actually wasn't Hepzato, it was something else, but I didn't get the chance to do that because Chemtrack decided, okay, it doesn't want to work. So I had to go to Hepzato.
Yeah. And so then I don't even remember exactly when it was, but I know it was pretty much in the fall, right? Is when Hepzato was
Hmm.
first available to utilize.
Yeah, yeah. So I'm trying to think. I got my first Hepzato treatment before I moved down here. I actually got it in June. Yeah, so I did Hepzato, or sorry, Kimtrack for about 3 months, I
Okay.
would say. Yeah. And then just didn't work.
Yeah. So then from there, I
Yeah.
guess it was probably like, I don't know. We don't have to have exact dates, but if you've had three
Yeah.
treatments, they're spaced about every 6 weeks. So
Yes.
it's been 1.5, 2.5, three. I don't even know. It's been like
Yeah.
4.5 to 5 months, like in between there, plus a little extra time.
Yes.
But you were one of the first. I think you were one of the first patients that Honor Health treated in their, like, having their facility open to utilize the
Yes.
Hepzato treatment after they
I
did all the
was.
training of everything.
Yeah, I was. I was actually, I believe, the third patient that was actually able to do it. So I was kind of, like anybody, I was kind of nervous about it because I
Yeah.
was like, oh gosh, okay, okay, we're okay. And I'm actually one of the younger ones doing it also. Everybody else, of course, like we know with this cancer is a lot older than we are. So I didn't know, how it would do with my body and everything else. There was lots of questions for sure before I started.
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late stage development for primary choroidal melanoma and in early stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
Yeah, no, that totally makes sense. So let's chat a
Yeah,
little about like prepping for this treatment. Like obviously you
absolutely.
had lots of questions. So were you able to meet with the doctor, like with the whole medical team, or was there like a specific doctor or two that you met with?
Yeah, so I saw Dr. Mosier, of course, because whenever we found out that Kimtrack wasn't working, and we kind of chatted for a while about what the best next step would be. So I got to talk with him about it, and then actually Molly Drought, she is a nurse practitioner at Honor Health. She's the one that really runs everything with Hepzato. She is amazing. So she actually chatted with me for a good while about Hepzato and kind of went through all of the steps. And, without her, I think I would have been a nervous wreck. But she really made me feel comfortable and just was the best thing for me. She was so knowledgeable about it and answered every question that I had. I always have my mom and my husband with me as well at every appointment. So they were able to get their questions answered. And yeah, it was great. After I met with them, I did get to meet with Dr. Lowe. He's the main guy that does the actual treatment. He's, putting in the sheaths and everything. So I got to meet with him. And I just immediately fell in love with him. He's just an awesome
No, he's a
guy.
fun guy. Yeah, I've been
Yeah,
meeting him
he,
like, and I actually just talked with him today, like for my own appointment.
oh,
But,
awesome. Yeah,
but chatting with him, like we had him at I Believe as well, and he's a
yes,
very knowledgeable interventional radiologist
he
for sure.
is. Yeah, he is for sure. So, after I got to meet with everybody, I really did feel at ease. Like they just were super knowledgeable about everything and really made me feel good. So that was
So,
a
okay, you
good
met with the
thing.
doctors.
Yep,
Met with the doctors, had lots of questions, obviously, which everybody's
yep.
questions are going to be different. But I know like some of the questions that came up for me, like just for anybody listening, maybe
Hmm.
these were some that came up for you. So I guess if there's anything else you feel like came up just for any caretakers
Yeah.
or patients who might be going into this procedure, like I was asking things like, okay, who can be back there like in the
Hmm.
ICU, because at least at Honor Health they keep you in the ICU, and he explained the reasoning behind that, just in case you need to get any blood transfusions like platelets,
Yep.
plasma, blood, any of that all has to be
Yep.
administered in the ICU. So it's not necessarily because you're like at this horrible risk. It's just to make sure they can administer blood if needed. And he just mentioned that, it was only going to be roughly an overnight stay. Like it wasn't necessarily going to be 24 hours from when I woke up.
Hmm.
Like it kind of just depended on how everything went. I think I asked about just recovery time coming out of it. Like how long should I maybe not lift weights, or like should I avoid
Yep.
picking up my kids, or any, not that
Yeah.
I pick up my children very often. They're
I
pretty
mean,
big.
they are, but with women our age, we have to think about that because we
Yeah.
still have mom life. A lot of
Like
our
and like picking up
patients,
like picking up my Stanleys like 5 pounds.
yes, absolutely. You still have to live your day-to-day life and be a mom, and we have to ask these questions.
Yeah. So I mean, I just was very curious. Like, okay, what do you like? I've gone into liver surgery before, like
Hmm.
kind of underestimating what my recovery was going to be like, and then was kind of caught off guard by how painful
Yep.
or like uncomfortable I was. And so just asking, like what are we looking at here? And he's like,
Yeah.
most people are feeling pretty okay within the first few days.
Yeah.
And by about 2 weeks, like you're really pretty back to totally normal, at
Hmm.
least for whatever your normal is. Barring, a few exceptions. There's obviously
Yes.
exceptions, and everybody's going to be different. So did you guys have any other like specific questions you can think of that came up?
I don't think so. I think the biggest thing was the recovery time for me.
Yeah.
Just because, like I said, we have young children, so I need to know, okay, how long do I need to have my caretakers here? Because I do
Yeah.
have my mom and my husband that are here taking care of me. So I need to make sure that they're able to get off of work and help me and everything with the kids. And so that was my biggest question, of course.
This is a little bit of a, I guess, just a teaser question.
Hmm.
Obviously you had these appointments with Molly, with the
Yeah.
nurse practitioner, and so they had during these appointments, just for reference, they explain everything to you. Like they tell you how
Yes.
it's all going to work. They tell you what you're going to do to prepare. Like they're not just like going in and saying, okay, you're going to have this treatment. What questions do you have? Like they explain it all
Yep.
first. They have really good
Yes.
visuals. If you haven't looked at the Hepzato Kit website, they have some really good
Hmm.
visuals that show what it looks like. And actually, our most recent liver-directed webinar, Dr. Padia, he really he showed some visuals as well that explain, how does this work and why does it work the way that it does? Because, people are walking away from it and they have relatively low toxicity to the liver. They're just kind of maybe not bouncing back is not quite the right word, but like they're able to live a pretty good quality of life considering what's happening for the treatment. So definitely check those out if you haven't. I'll link some of those in the show notes, like for anybody watching this. And if you haven't hit subscribe, don't forget to subscribe while you're watching this. We need you guys to follow and help us get to over 1,000 followers on our YouTube channel. So, okay, Allie, pre-screening. What all did they have you do before the procedure? Because there's some really important tests that they have you do ahead of time, besides just your MRI.
Yeah, there is. So the biggest thing that you have to do is make sure your heart is healthy enough. So the way that they kind of test that out is you do a stress test. So that was kind of something I didn't even know about. I was like, oh, that's kind of cool. I didn't even know a stress test was a thing because I'm young and, didn't really know. Yeah. So whenever I went into there, it really doesn't, not for our age, no. So, I had to go to a cardiologist and do a stress test. And of course, everything came back that I'm healthy, just this lovely cancer, just like you.
just cancer in your liver, like you're healthy, but like there's just it's kind of it feels like a sick joke a little bit.
It really is. Yeah, it really is. It's like you look so great. You look so great type
thing.
Thank
you. My body says it's fine except right here.
Yeah. But absolutely. But yeah, you do that pre-screening, and then other than that, you do an EKG and also just lab work to make sure that your white blood cell count, your hemoglobin, everything is where it needs to be, so that way you can safely get this chemotherapy.
How often do you have to do the pre-screening? Like, do you have to do the echocardiogram stress test every single time?
You do not have to get the stress test done every single time. That is just at the very beginning. Every 6 weeks before you come in for your Hepzato, you will get that EKG and you will get those labs done just to make sure that everything is good from last Hepzato treatment and that you are just safe to go.
Yeah. Well, that makes sense. And then I think you were telling me that once you have the first treatment, it's kind of all this testing is done, up to maybe a month or so ahead of time, just depending on how soon they can schedule things out. Like I know I'm a month out from treatment and I've already had all the screening done. Yeah. But when you go into the 6-week pattern, like you're having these kinds of the labs and the EKG, those are just done the week of the procedure, right?
It is. So the way that Honor Health does it is we have our Hepzato treatments on Wednesday. So I always see Molly and Bree on Mondays to get my EKG done and my labs done. And so they want to have it, I know you cannot have it more than, I think, 3 days, because then you'll have to do it again.
Gotcha. Yeah. So they have to have it within a certain window of time. So my guess is I'll, going into my actual procedure date, I'll probably have to have labs and an EKG done one more time. And just kind of as a caveat for any of you guys listening, the EKG is going to check heart rhythm and things like that. And if for whatever reason anything were abnormal, my guess would be they would have us repeat a stress test. They would, the stress test echocardiogram would be something they would go back to if they needed to, but it's not necessarily required every single time. It just really depends on how your body looks every single time you have the pre-screening stuff. Sounds so technical stuff, guys. I'm here for it. Okay. So how do you like the team that you've had, that's been organizing all of your care and each of these consecutive Hepzato treatments?
Absolutely. I love my team. I really do. You're just going to love them. I promise. They are just the best and they truly just care for you so much. And even, so you have I feel like 2 separate teams, because you have your Honor Health research team that we see all the time, which is Molly, Bree, Dr. Mosier, Chelsea. They're all just amazing. And then you have your radiologist team that you get to go to in the hospital. And they are awesome as well. The anesthesiologist that is there that does Hepzato, because, his job is so important, but you really, you kind of think, oh, Dr. Lowe's job is the most important one, but actually it's the anesthesiologist's job that is very important. And he's amazing. So the team is just great.
No, I love that. And I'm really glad like that
Yeah.
we're getting to talk a little about this. I mean, obviously maybe we're a little biased. Maybe we're
Hmm.
like a tiny
I
bit
know.
biased because like
We,
we've
yes.
seen them all the time, but also you guys like one of the big things that I really like to try to emphasize is that there's more care available to
Hmm.
patients out west. Like a lot of patients kind of just in the Facebook groups, you guys tend to maybe have this belief, not all of us, but like some of us have had the belief
Hmm.
that we have to travel to the East Coast for treatment. And
Yes.
I just want you guys to know there are wonderful doctors out here in in the Phoenix area, in
Hmm.
California, in Washington, who are in Colorado. I'm like trying to think where else, like in Texas, like who are all working
Yes.
really hard to make sure that they have available treatments, trials,
Hmm.
things like Hepzato, which obviously like Hepzato is newly FDA approved. So that means like that it's no longer something that is, experimental in the same ways
Hmm.
that it was to get that FDA approval. They are still
Yes.
learning with it, right? Every team that is doing Hepzato on a new patient, they're learning with each patient, how well things go. Like they're learning how to improve the process, and they're just constantly like the Hepzato people, like the Hepzato team and the company that is behind it, like Delcath is phenomenal at trying to just support their practitioners, support all of the
Hmm.
physicians, support the patients involved, like throughout the whole process. I think that it's like Hepzato Access, I think, is a resource that patients can register for as well, just for kind of additional support in getting questions answered, and also in the insurance appeal or, insurance approval process. Did you have any trouble with getting the insurance approval, or did everybody at Honor Health
So
just take care of that?
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
yeah, everybody at Otter Health just takes care of it. So I'm one of the lucky ones. Like my husband's in the military, so we have TRICARE, which is a really great insurance. So we do have our frustration with them with the just getting referrals. It's very hard for us to see outside network providers, which Dr. Mojer was an outside network provider. So it took me about, I want to say after I got my diagnosis, it took me about 3 months I had to convince these referral people that
Yeah.
it was a
That like
medically
you don't
necessary
have,
thing
yeah, you don't
for
have
me
another
to
doctor to go
go.
to.
Yes, because and it's terrible, but I literally had to say, my life is on the line if I don't see this doctor, and
Yeah.
you need to understand that because it's a true thing.
Yeah, no, it really
Yeah,
is. And it
yeah,
anyway, we could get into the weeds of insurance.
yeah.
We will not do that. That's not where we're gonna go. But I'm really glad that it went well, and that and that's
Hmm.
been the case for me as well. Just that the Hepzato Access team works really closely with any of the medical providers, like who are getting prior
Hmm.
authorizations or who are helping you navigate the insurance process, so that it's very
Yeah,
hands off for patients. Which I
yes, it
really
is.
appreciate because I had a really bad insurance experience myself like earlier this
Yes,
year, and so it's really really helpful just to know that ahead of time, that for the most part they're really working hard to make sure patients don't have to bear the weight of this.
they
Um,
really do. They
yeah,
really do. I know with whenever I went in to see Dr. Moser before I started Hepzato, he already had my pre-authorization, everything done before I even had my
he's like
appointment
it's
to
ready, we're
even
good.
mention Hepzato. He's like, you're already done. You're already ready. You're scheduled for this date. So yeah, they're awesome.
No, they're really organized. I've
Yes.
appreciated that about this last like week and a half. So let's chat about like the day of. So I
Okay.
know like day of, day after, you go in for the procedure. We talked about how you have to stay overnight. So talk to
Hmm.
us a little about what was it like maybe the first time versus the second and the third time,
Yeah,
because I know
absolutely.
it's a little bit different like once you kind of get into the rhythm.
Yeah, whenever you go into the hospital, there's really nothing that you actually do. At Honor Health, we have our own like little prep area, so you are literally the only one in there, which is nice. It's you and two nurses, and they just make you feel so comfortable. Molly and Chelsea, those are, like I said, the head people on our team. They will come in and just make sure that your anxiety is good, that you understand everything that's going on, everything like that. And then you do have to sign some paperwork, of course, just giving them authorization to be able to do the treatment. And then, you'll meet with Dr. Lowe. Dr. Lowe comes in and he explains everything, make sure you're feeling good and ready to go because with this treatment, you cannot go in weak with this treatment. You have to go in ready to fight a war. So you have to have that mindset mentality. Okay, I'm going in as a warrior today. That's something that I have found that I need to do, is just go in ready to fight. Because it's a big treatment, that it's a big thing that you're doing to your body. Your body is going to hate you after, but it works. So like I said, you'll see all of your doctors. Your anesthesiologist will come in. He will give you your good drugs, and they will you back into the room, and then you drift off to sleep, and you wake up, and
so they're not doing any of the
done.
placement of like any of these, any of the veins or the artery access points. They have
Absolutely
four
not.
access points. Like, you're not awake for any of that.
You are not awake. You
Thank
have
God.
no idea. The only thing you will get is an IV in your arm, and we're all used to that as cancer patients.
Yeah,
So.
for sure. Okay, so this is kind of a funky question. I know, like, they do the heart tests, and they're monitoring your blood pressure, all of that. Do they use just a normal, like, arm vein, like a hand, or, like upper forearm or lower forearm? Or do they use an arterial artery, or like an arterial vein?
You'll have a lot of them, but whenever you first go in, you're just going to use a regular vein. I also have a port that I had for my Kimtrack, so they can use that also.
Okay, gotcha.
So it's just whichever one I choose, either the regular arm vein or my port. I usually go with the arm vein because the port is, whenever you wake up, you've got a lot of instruments. But whenever you do fall asleep, that's whenever they'll put in all of your sheaths, and you will have a blood pressure monitor that will be in your wrist, the artery right there.
Okay, but they don't put it in until after you're
They
asleep.
will not. Yes, you are all asleep. Whenever all of that pain happens, you are fast asleep. So, and then whenever you wake up, I don't even feel them. So.
Okay.
You're good.
Well, all good things. Pain relief,
Yes.
numbing, all the things.
Yeah.
I do appreciate like that you're, just emphasizing, and the way that I've tried to explain it to people is, there's good reason to feel nervous, because this is kind of like the big guns of liver-directed therapy. This is about as intense as it can get. And, in terms of what are we doing to the cancer or to the healthy parts of your body to try to stop the cancer from continuing to grow. So it is, it is important to have that knowledge and understanding, but I think it's also, also good to just recognize that it is something you can recover from relatively quickly. That most people are tolerating it fairly well. All things considered, right? But I think that it's that all things considered part that maybe throws us off guard. And sometimes we go into things like, thinking, it's just going to be a breeze and it'll be totally easy and I'll be fine, right away. And it's like, no, you're having a major procedure. You're going to need some downtime. Like, anticipate that. Plan for more, like, depending on how your body responds the first time, or, just any of those kinds of things. I guess I kind of imagine going into the first one, you kind of have to approach it like this is a little bit of a learning experience. It's a learning experience
really
for the
is.
doctors, and also for you and your care team to like figure out what do we need after.
Yeah, because every patient is different. Everybody's anatomy is different. So one thing that I learned with my first Hepzato treatment is I have a different anatomy. Shocker, everything is different with me. So I had a different anatomy. So they actually took a little bit longer doing my first Hepzato treatment, because they had to find the correct arteries to be able to put those sheaths in to block that liver. So your first time around is going to be a lot longer. So my first time around was about 6 to 7 hours long. My second and third one, only 4 hours. Once they know your anatomy, it does go quite quick.
I know, like with my doctor, revolving or talking about what do we anticipate, right? For how long is this going to take, the first time versus the next time. Obviously, there's no way for them to give you like an exact, like, it's only going to take this long, because, this is it. When you have anything happen surgically or, in a procedural kind of a standpoint, there's all kinds of extra things that they have to plan for and pivot for and change and adjust. And like you said, physical anatomy is one of them. How your body tolerates the anesthesia. Like there's lots of contributing factors to how long does it take. I think I was told to estimate at least 4 hours, like 3.5 to 4 hours minimum. Like, but obviously there's room for it to be more. There's room for it to be less. It just depends. And so just planning for that. But then you have the procedure, you wake up and you said that you have the sheaths, like they're like the little artery access points that it's like your two in
Yep.
your neck and two in the leg, like groin artery areas.
Yes.
And so those are still there.
Hmm.
And then what happens? Like you're slowly waking up from
So
anesthesia and
yeah,
then
you're waking up, your doctor's there to make sure that everything is okay. They will run a EKG and do blood work before you wake up, just to make sure that your heart is good. And then they do the blood work to make sure that everything is okay, as well as what you need, because you're going to need some stuff. If you think about Hepzato, they filter out about 2 liters of blood. So you are going to need blood products whenever you wake up. So just anticipate that. For me, I only had to have about some plasma and a blood thickener, because they do thin your blood out pretty drastically. So you're going to get a blood thickener whenever you wake up also. Once you have all your blood products, your blood is back to normal, that's whenever the anesthesiologist team will come in and they will remove 3 of those sheaths. They will leave one of your veins so that way you can just have access for medicines, and in case you need another blood product throughout the night, that it's there for you.
okay, that makes sense. I'm gonna just, go out on a limb here and say that they're giving you something to make it so you can't feel it when you remove those when you're awake.
No.
No? Okay.
No.
Is it
Um,
fine? Like, I mean, let's just
you
be
know,
honest for those of us who have a low pain tolerance.
I will be honest. So you want to know something? It's more in your head.
Okay.
It is in your head. Because what they pull out of your vein is quite long, and it looks like a big
Just
noodle.
don't watch. Don't watch, you guys.
They
Don't
will tell
watch
you
the
to,
spaghetti.
yes, they will tell you to take a big deep breath in, and whenever you release, they will pull. And it happens so fast, you can't even think about what's going
Well,
on.
and like you're
And
still like I'm sure in a daze. I've been under a few times, like, and you're
you,
still in a bit
you,
of a daze.
yes, you are. Just don't watch. I like to turn on TV, and they are okay with that. So I just sit there and I watch TV.
Distraction.
But yes, whenever they come in and they take those sheaths out, they are going to be with you for about 30 to 45 minutes, because they have to sit there and hold pressure for a
Right.
long time. And I'm not going to sugarcoat that. It's kind of a little painful, because they are quite sore. They're really holding pressure so that way, your blood can clot, and you're good with that.
Yeah.
But once that's done, it's okay. Once that's done, they'll put the a patch on, and then once those are out, you do have to lay flat for 6 hours. This is the worst part of Hepzato, is laying flat for 6 hours. Your back is going to be so mad at you, but don't be afraid to ask for medicine, because it's there for you. You can get some good medicine to really help you get through that part.
Okay, so from what you're
Yeah.
remembering, have the treatment, and then they, monitor you, eventually remove the
Hmm.
sheaths, and then you wait
Yeah.
for 6 hours, or is the six
And then
hours
you,
part of what happens before they remove
no,
the sheaths?
the 6 hours starts as soon as those sheaths are removed.
Okay.
That's whenever your 6 hours usually starts.
Okay.
Yeah.
I think that
Yes.
makes sense. At what point when you wake up and like this,
Hmm.
all of these things are happening, at what point can a caregiver be with you in your room, like in the ICU?
So as soon as I wake up, my mom is there. My mom is the one that stays with me in the hospital, so that way my husband can be here at home with my kiddos. And my husband does not do very well in the hospital, so it works out really well.
There you go. All right.
Yes.
Is she present when they're pulling the sheaths, or is she
She,
present when
she
they're...
she is present as much as she wants to be. Usually my mom likes to go grab coffee whenever they pull the sheaths out,
I
and
mean,
that's totally okay.
yeah, like that's okay.
Yes.
All right. So then I guess just kind of as we finish up,
Mhm.
what kinds of side effects have you had, after the fact? Or maybe let's talk a little about what's been the first few days after treatment versus
Yeah,
a week or
absolutely.
two out.
Yeah, so you stay in the ICU room for a little while until you're ready to go home. The doctors will come in, they'll monitor you and make sure that you're all good to go. Once you go home, I really like to take it easy that day. Your body really does feel like noodles, so just go lay down, take a rest, let your caregivers do the job that they need to do because that's why they're there. It's okay to have care. Let them do what they're here to do. They love it. You're not
and
a
that can
burden.
be really hard to
It
accept.
is.
We really like to be independent, especially, I don't know, maybe it's a mom thing or maybe it's
It
just
is.
our age group. I don't know.
Yeah, it is. It's very difficult, but I have learned that with my first time around, I tried to do everything and I regretted that. So I would totally suggest just take your time, listen to your body, and
Yeah.
it's okay. It's okay to ask for help for sure. But I took I would say about a week of recovery the first time. The second and third time was a little bit less than that.
Okay. Did you have any kind of pain or nausea or like some of the most common side effects if you like read on the website? Like I think pain,
Yes.
like abdominal pain and nausea are like some of the top ones.
Yeah, I did experience a little bit of abdominal pain with the Hepzatos. That was probably about your first or second day is what I kind of experienced. I was okay just taking Tylenol. I didn't have to do anything hard. And
So they do let you
just
take
like I said,
Tylenol then after.
they
Because
do. They
sometimes after
do.
liver stuff, they don't like you to take Tylenol.
Yes, no, they do allow you to take Tylenol and, just really just take care of yourself. I have found I do have a heated blanket and that has really helped me also just with the pain in your legs and your tummy. That has really helped me.
Okay. No, I think
Yeah.
those are good things. And
Yeah.
I'm sure like there's for whatever you're experiencing as a patient, like going through this, like I would venture to guess that if you were to talk to your medical team about it, like and you're experiencing it, you're not sure what to do or like what you're doing isn't working. If you were to
Yeah.
call like the nurse team or the nurse
Yes.
practitioner in charge of your case, they would most likely be able to give you some suggestions of like,
Yes,
here, try this.
absolutely.
Like these are, other ideas to do instead of what maybe you've already tried. Okay, and then so I know you were on Kimtrack before. Have you had any other kind of immunotherapy alongside Hepzato?
I did not. So I did not have any tumors outside of my liver whenever I started Hepzato. And Kimtrack was something that really didn't work for me. So with communicating with my doctor, we just really didn't want to add that added stress onto my body with
Yeah.
adding another treatment. So that's something that I did not do, but I know other patients have done it and it's worked for them. So it's okay to have that.
Yeah, and that's something that is definitely being evaluated, right? It's being evaluated by
It
a
is.
lot of medical teams across the country who are just trying to determine like at what point and how effective is
Yep.
it. But one of the things most of the doctors who I've talked to about Hepzato have said is that if you are on immunotherapy, right, that is working and helping, that they will
Yep.
not have you stop that necessarily. Like
Yes.
you will be able to continue, like say, obviously if it was an infusion the same day as your treatment day, that wouldn't work. But you don't
Absolutely not.
necessarily have to like, oh, stop like 2 weeks ahead and then continue 2 weeks after. Like
Yeah.
it's really pretty consistently like able to be done alongside, and they are
Yes.
studying like, okay, is it more effective, right? Does it make it
Yes.
more of a I don't know, a sucker punch, so to speak, to what's going
Yeah.
on with the cancer, to capitalize on chemo plus immunotherapy. Like that
Yeah.
combination approach is definitely being explored and studied for sure. And I mean, I'm just a big person, like a big believer in the placebo effect or just in what we believe going into something, right? That if we as a patient believe that it's going to be really hard, like our body listens to that. I
Yeah,
think.
it does. It
And
does.
so I love what you said too about going into this with that mindset of like, okay, this is going to be hard, but I'm going to be able to do it. And
Exactly.
I know that, we've talked a little about some of my own like anxiety as a person, like about some of this.
Yep.
And that's just something to, to prepare for, mentally, emotionally, whether it's with a therapist or just with the support of your team and just getting more information, like learning what you need to do as an individual to like help kind of prep yourself. Because I think I don't want to say we luck out, right? Because we have a really sucky cancer to deal with.
We really
But
do.
in some ways, some of us don't experience any kind of intense treatment until this point, right? Like,
Yes.
I mean, arguably liver surgery, anything like that, that can be intense, but it's not the same as
Yeah.
like, oh, you had a weekly infusion or
Yes.
like something that's causing continual side effects, like maybe a clinical trial that you're on that maybe it's working, but the side effects are gnarly.
Yes.
And so to go into it and having never done anything that has created those kinds of side effects, I know for me, like that's like super nerve wracking. And so I'm I feel like I trust my medical team, but I'm also like
Yeah,
low key a little bit freaked. And I think that's relatively normal. I think it'll get better like each time that I do it.
it
I hope.
will.
But
Yeah,
how
it
did
will.
you
Because once
like,
you,
how did you feel like the first time versus now the third time doing
yeah,
it?
well, the first time it's so unknown. And that's the thing is with this cancer, it's the unknown that really haunts us all. And so once I got the Hepzato and I got that first one on my belt, and I was good after that. I know I'm in great hands. I know I have the best team, and I'm okay. And so I'm not going to say that I look forward to seeing them every single time I go in there, but whenever I do sit in that chair and they do come in, I do feel at ease whenever I do see them. So it's good. It's okay. Yeah, Hepzato is definitely something that it's whenever you read about it, you look at it, it's intense. But once you actually experience it and you kind of get the rhythm of it, you feel better.
Yeah, no, that makes sense. I think
Yeah.
I really like what you said about the unknown, that's really kind of some of the worst feeling of it is the
Yes.
unknown. And I think that we can all relate to that. Okay, so just to end then, Allie, thank you so much for your time, your
Hmm.
story, like just all of your insights. I feel like this has been monumentally helpful, and I hope those of you guys listening, if you're considering Hepzato, like that this has helped kind of alleviate some of your concerns. What would you tell someone like me who's like nervously considering this, but maybe they haven't really decided if they really want to like do this or not?
I always tell patients, the grass is never greener on the other side. Just because it's working for one patient does not mean it's going to work for you. So obviously listen to your doctor because they are the ones that know the best, and they're not out here to sabotage you. Listen to what they have to say and make sure that you're getting your questions answered, because if you're sitting here wondering, okay, I need to get this question answered, just text them and ask them. That's what they're there for. They're here to put you at ease. So that's my biggest thing. If you're considering Hepzato, it's okay. It's okay. It's not as scary as you think to have.
Yeah.
It's a good treatment, and it's really worked for me. For someone that has had a defeat with a treatment already, to go to this one and my tumor is almost halfway shrunk, I'm pretty okay with that.
Oh, okay, we forgot to cover this. You've had the ctDNA test done as well, right? The
I
Signatera.
have,
Okay, so
yes.
talk to us a little about that because I know that that's a big one
Okay.
for you.
Yes, so my ctDNA, whenever I first started Hepzato, it was 3.74. After my first treatment, it did go down to 2.21. After the second one, y'all, it was 0.
Wow.
So I just had my ctDNA done again, and actually haven't had treatment in about 12 weeks. Just having one of those side effects from Hepzato is your white blood cell count. It does affect your white blood cell count the longer that you have Hepzato, but they do have treatment out there to kind of help you with that. So don't be nervous about it. They
Yeah.
have shots and everything that you can do to help boost that white blood cell count again. So I did get a ctDNA and it was 0.24.
Okay,
So
so just
nothing
barely
crazy.
noise.
Nothing crazy, y'all. Yeah.
Yeah. No, that's really
Yeah.
cool. And you guys, if you don't know
Yeah.
about the ctDNA or if your doctor isn't running one, please just reach out to them, ask them about
Hmm.
Signatera and about how they can, use any of these, not just Signatera, there's other ctDNA tests out there, but there are some very specific ones that in some cases can find if there's kind of cells floating around. And I think it's been really cool to see patients who are having Hepzato and have their ctDNA
Hmm.
drop from something really high to something almost non-existent. And I really hope that you're able to get another treatment soon. But I also
Hmm.
appreciate that like you got the 3 treatments under your belt and that's been good.
Yes.
And now you have had enough of you've had a break. And so hopefully going into the next one, like your body
Hmm.
will be, prepped and ready and it'll feel as good as it can feel. Right. But like
Yes.
it
Yes.
will be, maybe even more effective, right? Just having had the break.
Hmm.
So
Yes.
anyway, all right, you guys, thanks for listening. Thanks for tuning in. Huge thank you to our podcast sponsors. We couldn't do this without you guys. And Allie, just a major thanks to you for doing this and for
Of
making the
course.
time and being willing to share your experience. Like, I know we got into some of the nitty gritty.
Yep.
All right, you guys, we'll talk to you next time. Thanks.